This is Eyewitness News with live breaking news.
And Orange County confirming the first case of West Nile this year. We're talking to a specialist about keeping your family safe from that and Zika. As we mentioned earlier, health officials in Orange County now reporting the area's first human case of West Nile virus this year. That patient, a woman in her 60s, said to be in serious condition.
Joining us to discuss West Nile virus and the growing Zika virus scare, Dr. Casciari, critical care specialist with St. Joseph Hospital in Orange. Thank you so much for joining us, doctor.
Thank you for having me.
How significant is today's finding?
No, this is very significant because West Nile virus can be a very bad disease. It's a disease involving the neurologic system, so you can have coma, you can have long-term effects, and even if you get a case from which you recover, it can last several months. So it's a bad disease. The interesting thing is that the Zika virus and the West Nile virus are spread by the same mosquito, which means we must have that mosquito here, right?
Good
wow,
point.
that's pretty scary. Let's talk about who is most at risk. We know, I mean, we hear with West Nile all the time, the young and the elderly. Is the same hold true for Zika as well?
Actually, it's all with viruses, it's always the young and the elderly, but with Zika it's a little different because most people, if they get Zika, don't even know they have it. Only 1 out of 5 people get any kind of symptoms at all. The danger with Zika is twofold. One, you can get a disease called Guillain-Barré syndrome, which is a prolonged paralysis, and anybody can get that. We had that back with swine flu in '86. But the more significant thing right now is that if you're pregnant and you get Zika during your pregnancy, you can have a baby with significant neurologic defects in microcephaly, which is a small head and incomplete development.
And that's very scary. Well, now there's 15 confirmed cases in Florida of Zika. How worried should we be here that is going to spread to the West Coast?
It is going to spread to the West Coast. But the good thing about Florida is we're going to be able to study Zika significantly because we've isolated that area. And they're going to look at every single case, and we're going to find out if you get Zika, what's the chance that your baby will be affected? If you get Zika, what are the real symptoms? Because right now, it's been in countries of the world where we don't really have that good a reporting. We're going to learn a lot about Zika, and a vaccine is being developed. Now, having said all that, at the moment there's no treatment. So we have to deal with prevention.
Well, let's talk about that. How do we prevent? We heard the governor of Florida come out and say that the top 4 things you can do were all standing water in the area.
Yeah, you got to get rid of water.
Standing water.
Right.
So I'm sure that's the same here.
And by the way, a spoonful of water can breed thousands of Aedes mosquitoes. So, all right, number 1, use the drought to your advantage. Get rid of any standing water in your property. But number 2, personal protection, especially if you're pregnant or thinking of getting pregnant. Yeah. So you want to wear loose clothing. Tight-fitting clothing mosquitoes will bite through. The Zika mosquito does bite all day long, not just morning and night.
Okay.
Number 3, if you put on sunscreen, put the sunscreen on first, put the insect repellent on second. If you put the sunscreen on over the insect repellent, it won't work.
And the repellent should have DEET in it?
DEET is the best. Pericardin is also effective. Actually, Consumer Reports has a fantastic issue showing which insect repellent preparations actually work.
Okay.
And some of them work for up to 8 hours. So
good to know.
It's kind of scary times. We've seen pregnant women not want to leave the house. That's this is such a crunch that we're under here, but we appreciate you helping us.
Yeah, Dr. Casciari, nice to have you. Hopefully you'll come back soon and visit us again.
Well, thanks for having me.
Thank you so much.
All right.
Thank you, doctor.